Right, so Starmer's Labour caught up in yet another scandal then, Damo. They seem to have one of those almost as often as they send more money to Ukraine, you might already be thinking. And that's a fair point. They do seem to end up in hot water more often than a laundrette, this lot under Starmer. And this time it's over the NHS, because they've been caught telling some major porcupines, all about NHS waiting lists. But worse, it seems a bit of bribery of our general practitioners might actually be involved as well, because nothing fixes waiting lists faster than making sure more people don't get added to them. Not only does this obviously put lives at risk, it destroys trust between GP and patient. If the patient can't be sure their GP actually has their best interests at heart. This latest scandal, now having been brought to light, is apparently seeing GPs getting £20 per patient that they don't refer, incentivising GPs to withhold care, and the reduction in waiting lists being artificially engineered at the expense of the lives of ordinary working class people. Under Starmer's Labour and his weasel of a Health Secretary, Wes Streeting, you have two MPs having taken massive donations from private health interests, who have integrated more private health provision in line with US healthcare models, integrated care systems acting as gatekeepers to deny patients treatment, overseeing an NHS that might still be free at point of use, but is being hollowed out from within, systematically dismantled through privatisation, rationing of healthcare, and outright deception. Starmer and Streeting are prioritising private profits over patients, embedding corporate interests in the NHS, and forcing through dangerous reforms that threaten the very foundation of universal healthcare. Reform Streeting is on record as saying, "We either accept or he's prepared to see the NHS die." Free at point of use isn't the same as free. If it's costing us all more by stealth, so private profits balloon, we'll have let the NHS die ourselves. Right, so under the guise of reducing pressure on hospitals, the government has introduced a scheme, and by scheme I mean scam, that is offering GPs £20 for every patient they do not refer to secondary care, i.e. for specialist treatment, off to hospital, you know what I mean. Now Labour would love to dress this up as about efficiency. They'd love you to think that is what this is all about, to make the NHS more efficient. But if you're introducing cash incentives for GPs to not refer, bribery and corruption in my view as that is, well, there will certainly be some unscrupulous GPs, perhaps some in practices that might be particularly hard up, that will do so. I would hope their oaths would mean more to them, but this is what this is. It is not about efficiencies at all. It is a financial incentive to deny care. This is very, very dangerous for several reasons, of which some will be obvious to you, but others lend themselves towards making Labour policy a reality by crook more than hook. Overwhelmingly, the most toxic part of this is that it will undermine trust in GPs. The doctor-patient relationship relies on trust. Patients have to trust their doctor will do whatever is in their best interests. But if patients suspect their GP is withholding referrals, potentially for profit, as this news breaks, that trust is going to evaporate. On top of that, the refusal to refer in the case of someone who absolutely should have been referred won't make waiting lists go away. It will simply screw up treatment responses for various conditions that don't get picked up until much later, when matters worsen for a given patient, and it becomes obvious. Questions could then be asked, why no referral before now, which could put GPs in a pile of hot water for their £20, something I doubt has escaped them either. But the damage is done with the trust being broken down, with the patients being made more suspicious of their doctors. Delayed diagnoses and worsening conditions, many serious illnesses, the ones that will immediately spring to mind most immediately for most of us, I would imagine, being something like cancer, require swift referral. Delays will mean progression of that disease, suffering, and inevitably avoidable deaths. And why are Labour doing this? It's a false solution to waiting lists. Instead of funding more hospital capacity, the government is hiding demand, not reducing it, swearing blind it is getting the list down, but doing so not by improving treatment or health outcomes, but by cooking the books. This is not about improving healthcare, it's about manipulating statistics to claim success while patients inevitably pay the price. Now, the groundwork for all of this has been being rolled out for a while now, the so-called and much criticised integrated care systems, or ICSs, which is just the rebranded versions of ACOs, which are all modelled on US-style managed care. In other words, profits first, treatment second, if you get treated at all. United Health, for example, is one of America's largest private insurers, their CEO famously having been shot by Luigi Mangione. He's deeply embedded in our NHS, and their new CEO, Andrew Whitty, has been openly admitting its role is to prevent unsustainable health treatment. What does he mean by unsustainable treatment then? If you need treatment, you need treatment. That's it. And that's what the NHS is for, right? Not if things carry on like this. In the US, insurers deny care to maximise profits all the time. Now ICSs are doing the same model. One part of this is something called self-care, which is just the most callous concept in healthcare. Fix yourself, basically, as that is. There is a push for self-care from Labour. And amid these ICSs, instead of medical treatments, we're all suddenly qualified to treat ourselves, apparently, but treatment could be withheld until we've tried to deal with it at home, come up with some home remedy for something, I dare say, and only after we've failed to get anywhere, dealing with, who knows, checking our own prostates now, perhaps. Will somebody then see us, perhaps when it's all too late, though? ICSs stand for Integrated Care Services. What they should stand for is prioritising cost-cutting over patient need. I don't care if the letters don't match. That is what it is. It's privatisation by stealth. All of this is part of Wes Streeting's 10-year plan, which involves closely aligning with the Darcy report, which came out last year, which advocates shrinking NHS services to create profit opportunities, making more profits for offering less treatment. Now, former MP Claudia Webb has been onto this one. She's been covering this and has warned in a piece she's penned for the Morning Star that this plan is a danger to us all, and yet Labour is ploughing ahead anyway. Here's an excerpt of what she said. In his report, Darcy lavishes praise on Tory health policy, particularly the 2014 5-year forward review, its subsequent continuation and the statutory rubber stamping of the US Accountable Care Organisation ACO system, which can be more accurately described as cuts for cash, and was subsequently renamed Integrated Care Systems, ICS, after bad publicity over US ACOs. The Conservatives' ACO push has always claimed to be derived from these changing needs of the population. But as a constant drive to ration services, cut costs and lower the NHS workforce skill mix shows, the real driver has been increasing potential profitability. In praising the 2014 onwards ACO policy, Darcy approvingly cites pilots of integrated care that were well underway in 2010, without mentioning that these pilots were set up by Kaiser Permanente and United Health based on the minimised state healthcare model they practiced in the US. US healthcare being pushed and being behind reforms designed to maximise profit whilst minimising care. Key elements of Darcy's appalling plans include hospital closures as part of a drive to centralise services, which will mean the shutting of local hospitals, forcing longer journeys for care. Those blasted self-care mandates again came from Darcy as well, pushing patients to treat themselves instead of seeing doctors or being referred. And of course the privatisation expansion, resulting in more contracts being handed to firms like United Health, Kaiser Permanente and others, lobbying MPs and of course making large donations to them. Well, there's a segue if ever I made one. Starmer and Streeting's claim to be saving the NHS, yet Labour's front bench between them have taken over £650,000 from private health firms, which is even more than the Tories ever took. Starmer has taken over £157,000 himself from private health, Streeting more than £193,000, and others who have taken significant sums include Yvette Cooper, who has taken more than £231,000, and Angela Rayner, who has taken £50,000. On top of the lobbyist cash, there have been the appointments to key roles within Starmer and Streeting's NHS reforms, like Samantha Jones being the ex-boss of health privatising firm Operos. She is now running the Department of Health. And overseeing Streeting's ridiculously damaging 10-year plan is Tom Kibasi, who used to work for McKinsey, one of the key NHS privatising firms under the Tories. These are not the sort of people you recruit to save the NHS. They are privatisation enforcers. Starmer's government is not fixing the NHS, it is breaking it even further, from bribing GPs to deny care now apparently, to embedding US-style rationing of care, carrying on from where the Tories left off, to flooding hospitals with underqualified staff like physicians' associates and anaesthetist associates who are not qualified doctors yet keep getting passed off as them, every move being prioritising profit over patients. The NHS belongs to the people as the Labour Party that created it intended, not corporations, not politicians of the sort we find in the Labour Party today who would have Nye Bevan spinning in his grave. Free at point of use isn't the same as free, and is of no use to us once it has gone from being a caregiving non-profit entity to a profit-driven, care-withholding corporate mess. If we do not resist what is being done to the NHS by Labour now, continuing where the Tories left off, we will lose it forever. The NHS is not safe in Labour's hands. And redoubling down on that point is the fact Streeting has brought back an old Blairite health secretary, turned private healthcare lobbyist no less, back into government. The warning signs just keep going off, folks. Get all the details of that story in this video recommendation here as your suggested next watch. Please do also hit like, share and subscribe so as to ensure you don't miss out on all new daily content, as well as supporting the channel at the same time, which is very much appreciated, holding power to account for ordinary working class people, and I'll hopefully catch you on the next vid. Cheers, folks.